I'm Lizzy Tapia. I'm the president of Local 2.
And you're on 81 days. You announced that this strike, it seems like it's a long strike that's going on. Why are the hotels taking a hard line against keeping your healthcare system?
Yeah, you know, I think the bosses truly think that because of the pandemic that we're going to be vulnerable, that this is their opportunity to do what they've always wanted to do, to gut our healthcare, to get us to agree to a cheaper plan, to get rid of some of the core things that are part of our medical benefits. So I think they see this as maybe their only opportunity to do that, so they're really dug in.
And this seems to be a growing issue among working people in this country with the healthcare companies. How are the healthcare companies connected to what's going on here in the hotel strike?
Well, I think that part of the challenge here, right, is that we fight really hard for our medical benefits. We fight hard to make Marriott, Hyatt, and Hilton pay for our medical benefits, and then the money that we win, we turn around and give it to healthcare corporations, right? And so it's money that doesn't go into workers' pockets. It doesn't go into feeding your family. It doesn't go into everything else that we have to pay for, just our rent, our mortgages. So I think that that's really a sign of how flawed the system is overall. What would be great is if some of these companies would help us to change the healthcare system instead of complaining about the cost of healthcare and trying to put that back on workers.
JP Morgan is going to have their annual conference here. Talk about that conference and what it's all about, that they would be coming to San Francisco, to this hotel and others.
Yeah, they come every year. So it's an annual conference that they have, and every year they bring these big rich investors to come together with healthcare corporations, pharmaceutical companies, and things like that, and they join together to essentially raise the cost of healthcare, you know, to make their products more profitable, and that falls on the back of working people. So of course there's outrage about that. Our members are upset. Working people in this city and beyond this city are upset about that. It's not sustainable. So we don't want those people in our city. We're saying better cancel this and go somewhere else.
And United Healthcare is involved not just in private healthcare plans, they're involved in Medicare, Medicare Advantage. Do you think that they're trying to privatize the whole healthcare system in this country?
You know, it's hard to say what they're doing or why, but I think the system, even as it is flawed. I think this is not a sustainable thing. We've got to have a change. But in the meantime, as long as we have this healthcare system that we do have, it's got to be something that working people can actually live with. And our members go bankrupt trying to pay medical bills if they don't have good healthcare. And so that's why it's so important that we secure that in this contract. And we're gonna stay out here until we win.
And that's the highest cause of bankruptcy in the United States, healthcare costs.
That's what I've heard.
Do these companies care about it?
I mean, it seems like the healthcare companies don't care at all, right? It's like, how do they make more money without any regard for what that means for people's health, people's safety, people's viability, people's ability to survive, right? So, yeah, it's really frustrating.
During the pandemic, a lot of your members lost their healthcare. They were telling me that as a result of the union, they were able to keep their healthcare. If they didn't have a union, what would have happened to them?
Yeah, well, I mean, look, I think so many people in this country experience that, people who don't have unions, right? And hard to know what would have happened, but we were able to extend medical benefits through our trust fund, and I think people were really grateful for that at a time when these hotel companies that say, oh, you're our family, we value you, and then turn around and cut people, not only close the hotels, people don't have work, but then, you know, refuse to pay anything to help people out. They weren't like sending, oh, let us help you pay for your groceries, let us help you with your health care. They did nothing for working people. So it's like, you know, leave you out there to die, and our union trust fund was able to extend the medical benefits. So I think that was really, I think people felt really grateful for that.
And they were getting money from the government, a lot of these companies?
That's right. They were getting like bailouts and yeah.
But your members were only bailed out by the union, really.
That's right, and even that is like not really bailed out by the union even, right? It's like there wasn't help for working people in this country during that time, right? So we did the best we could to extend medical benefits, and but for many of our members, they still haven't recovered fully in terms of work. They still only work 3 days a week or 2 days a week when they previously worked 5 days before the pandemic. So that's just really a sign of how these companies have tried to erode our work and create part-time jobs that used to be full-time.
And health and safety conditions, when they double up and have multiple tasks, is that going up among your members?
Yeah, we're seeing that a lot. So that's partly why a job that used to be 5 days is now 3, because if they can have a busser also serve tables, right? Or a server who's bussing and also a cashier, and they can do combination jobs, then that's one less person they have to bring to work. And so we're seeing that a lot throughout the whole industry, that the hotels have really tried to make those pandemic changes permanent.
And other workers, what would be the effect on other workers if you lose your health care here or forced to go to the company health care?
That's a good question. I mean, I think our standard is really high, but our members, cover their families, and it enables them to then have their kids be able to go to college. It enables them to be able to buy a home. Things that affect people's entire trajectory of their life, right, come from having a good union job with good union benefits. So I think it has a ripple effect in our members, but also beyond that. And I think that our standard is really high here. But San Francisco is a union town. It's a union city, and
it costs a lot to live here in the Bay Area.
Exactly.
How do people survive?
Yeah, that's a good question. A lot of our members don't live here anymore. A lot of people have had to move out. So even with a good union job, right? So there's a lot of pressure on working people, and we just got to stick together and really demand better.
And are you calling on other people to join the picket line, other unions to support you?
Absolutely. There's a lot of union members from other unions that are here today, and community members, because it's like healthcare is an issue for everybody, right? So we're out here demanding good healthcare. That's a fight for everybody.
And J.P. Morgan, do you think they're going to continue to come here in the middle of this strike?
That's a good question. Like I said, we can't control what they do, but we're calling on them not to come here while we're on strike, to not cross our picket lines, to not do business here that actually drives up the cost of healthcare, which is the reason why we're on strike. So it's got like two parts of it, right? It's don't cross our picket lines, and also don't do business that forces us to have these kind of fights, So hard to know what they're going to do. If I were them, I wouldn't want to have to deal with this.
We might have a problem here.
Yeah. It's really uncomfortable for them.
My name is Anand Singh. I'm the chief negotiator for Local 2. The city, 2,500 hotel workers are out on strike. This is day 81 of the strike. We are fed up with the excuses the bosses make. They want to gut our health care. Workers are not backing down in this fight. And so we're here to show them they're not going to gut our health care. We are not going backwards. We're going to win this fight one day longer than the bosses.
And what would it mean if they gut your health care concretely for your members? They want to go to their own plans, is that it?
They want to go to employer plans. They want a two-tier healthcare system. They've tried any number of ways to, take the burden off of the employer, put it on the employees to pay out of pocket for healthcare costs. That's not acceptable. These are multi-billion-dollar, multinational corporations. They can afford it. They need to do right by workers. And we're going to fight and make it so.
And J.P. Morgan is having an investors conference on healthcare next month. What does that have to do with what's going on with United Healthcare and the issue of healthcare for people in this country?
It has everything to do with it. J.P. Morgan has this conference every year. This is where the investors and the healthcare profiteers get together and craft ways to jack up the cost of healthcare. They are directly responsible for this strike and this fight, and they shouldn't come to San Francisco in January. And if they do, they're going to be met with a lot of resistance.
And the assassination of that United Healthcare, it seems like privatization of Medicare, that these companies have really taken over the whole healthcare system, and the healthcare, Medicare Advantage or other programs that they're running now.
Well, it's a broken system. We've known that for a long time. Until we get a single-payer healthcare system in this country, we're going to see all kinds of protests, rallies, and a lot of people, a lot of discontent, among working people in this country. So that's ultimately where we need to get to. But right now, we're focused on winning this strike.
And how long have you been on strike?
81 days.
And how are people surviving?
People are surviving because we're survivors. Hotel workers are survivors. They've survived wars in their home countries. They've survived terrible conditions. They know they have the tenacity and the will to outlast these employers. It means more to us than it means to them. It's about our families. This is about our futures. We're going to win this fight.
And the Trump administration, Project 2025, they don't believe in unions, public services, public health care. They don't believe they want company unions. Are you concerned? You think workers in this country should be concerned about what he's going to be doing in his government?
Workers need to organize. That's all it comes down to. Yes, there is a threat from the administration, but it's symptomatic of a larger problem in this country. When capitalist interests control the power structure of this country, and that's really what this is. And that's what you're seeing here right now. They want to keep working people down. They want to squeeze working people every bit that they can. We need to organize and fight back. That's what this fight's all about.
And Hyatt, Marriott, these companies, are they making profits? Are they making money?
Oh, absolutely, they're profitable. Absolutely. They've got the means to make this happen, and they're going to make it happen.